program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Welcome to your Hometown Health Show, brought to you by Trilogy Home Healthcare, the industry leader with over 30 years of experience in providing home healthcare services such as skilled nursing, physical and occupational therapy, home health aides, and other specialized care to your homes throughout the state. Please tune in every other week as we bring you a range of good information from specialists in the field to help make you more informed and living healthy.
There you go.
Good evening, everyone, and welcome to your Hometown Health Show. I'm Yolanda Santana, Service Manager with Tech One, an IT solutions company. And tonight we have Alexis Morpha, Administrator, and Alexandra Connor, Community Liaison for Fort Lauderdale Health and Rehab. Welcome.
Thank you. Thank you for having us.
Well, we're here tonight to introduce them to our listeners in Broward County and to learn who they are and the many exciting amenities they have to offer. Welcome. Could you please tell our listeners and viewers a little bit about yourselves?
Sure. So first of all, wanted to thank for the opportunity and our preferred partner for home health agency, Trilogy, for having us on the show. So, good afternoon, everybody. We're excited to be here, and we are Fort Lauderdale Health and Rehab. What we are is we're basically a leader in short-term and post-acute rehab services, and basically our mission is to provide healing for residents, their family members, and our community through relationships built on trust, love, laughter, and high-quality care with outcomes. We are conveniently located on Commercial Boulevard and Federal Highway. We can literally throw a rock across Holy Cross Hospital. They're within the same campus as our location, and we're within 15 minutes of all major hospitals in Broward County, including Broward General, North Broward, Imperial Point, and Florida Medical Center.
And did you want to say a little bit about yourself?
Well, yes, I've been with the company 6 years, and I am the community liaison. I actually have Holy Cross and Imperial Point, but have car will travel. I will go anywhere there's a referral. And it's a great company to work for, and I'm a huge patient advocate, and I'm a true believer with what we do and what services we provide for the community.
Great. So would you please let us know what services you provide and how you're different from other skilled nursing communities?
Okay. Well, we have a rehab specialty, which we have cardiac rehab, pulmonary rehab, joint replacement, stroke recovery, neurological rehab, prosthetics, ortho training, orthopedic conditions, surgical recovery. We also have the skilled nursing care part, which is 24/7 registered nurse coverage, post-operative care, pain management in-house, a specialist, a doctor, wound care management. We have an excellent sepsis program, in-house infection control, nutrition, hydration programs, and in-house dietitian, CPAP, BiPAP, catheter, colonoscopy care, off-site dialysis palliative program. We also have a hospice program and respite care.
Great. Wow, that's a lot.
You do a lot.
Definitely. Would you explain to our listeners exactly what short-term rehab is?
Sure. So most of our patients come from the hospital. That's really our number one referral source. And basically, just to quickly, talk about what exactly we do. We're an inpatient rehab focused provider. Technically speaking, we're considered a skilled nursing facility. So when most of our patients come to our facility, they go in there because they need to get back to their prior level. Let's say we have mom or dad that's out in the hospital. Usually when somebody's in the hospital and they're admitted for at least 3 nights or more, they're really not able to do what they were doing at home. One of the most common things we get is somebody with a high risk of falls. They end up, going to the hospital. Pneumonia is a leading cause of death right now, and they're elderly. So they will go in and get treated for pneumonia, but they're very weak. They could barely walk or stand up from home. So they come into facilities like ourselves, and what we end up doing there is trying to get them back to their prior level. How do we accomplish that? Well, there's 4 components that we do as an inpatient facility, and that's physical therapy. We have a physical therapist that comes in, assesses the patient, and they develop a physical therapy goals, which basically focuses on the lower body. Then we have occupational therapy. Occupational therapy focus more on the upper management and something called ADLs, Actors of Daily Living. So their goal is to try to work with the patients and their comorbidities to try to accomplish what your mom or dad or your loved one was doing before going to the hospital, before coming to our facility. And then we have speech therapy. Again, we go in and do an assessment or screen. One of the most common reasons why speech therapy will come in and assess the patient is anybody that has had a recent stroke or recent aspiration related to swallowing. A lot of different swallowing diagnoses, we get speech therapy involved. And then the last component, probably the most important component too, is skilled nursing care 24/7. So that's a very important component. You basically have a registered nurse around the clock making sure that everything is going okay with your health.
Okay. Who would be the typical patient who would benefit from this type of service?
Okay. Our building is a little bit older. We've been there for 40 years, and it's a hospital stay and requires intensive rehab and skilled nursing. Basically, what the accreditations are for our facility and what the care is the patients that we really push for is falls, patients that have had surgery, whether knee or hip, anything to do with maybe IV antibiotics that need a 24-hour nurse, and the settings of that they cannot be at home to take care of themselves, because a lot of the patients are by themselves and they go back home, so we have to actually, we're kind of a step down, like a little mini hospital prior to them going home.
And typically the type of patients we get are usually 40 years or older, and they again, we've actually had probably younger patients. We're getting a lot of baby boomers right now, and one of the most common questions is obviously making sure that we have really good reviews and really great outcomes. But one interesting fact, and I'm not making this up, is one of the questions they ask within the first 10 minutes of us doing the tour is whether or not we offer Wi-Fi. So we find that very interesting. So we do get a lot of baby boomers, and even some older, some of our more geriatric patients, they want to stay in touch with their Facebook friends, and you know what? There's nothing wrong with that. So anybody 40 years or older, we do get them sometimes younger, obviously, older as well. But interestingly enough, Wi-Fi is a very big thing for our population.
I can imagine so. Everybody wants to stay connected.
Yeah, absolutely, with their loved ones and friends.
All right. So I understand you have significant accreditations, and Alex, you touched on this a little bit. Can you explain a little bit more what they are?
Sure. So actually, I'll take the lead on that, Alex, if you don't mind. What makes Fort Lauderdale Health and Rehab one of the best facilities in Broward County? Well, first of all, we're a 5-star rated Medicare and Medicaid skilled nursing facility. And we don't get this because we're good-looking administrator or a good-looking marker out there in the hospitals. It's based on data. Honestly, the Medicare and Medicaid does not really differentiate yourself with how much business you're getting or what hospital you're getting. What they're looking at is outcomes, quality care outcomes, and that's something we're very proud to say, that we are a 5-star facility. About 35% of all SNFs in Broward County have this 5-star, so not a whole lot, and there's strict criteria with that. So that's one that's very important. Secondly, we were awarded the high performing level, and we are currently rated one of the best skilled nursing facilities in the United States according to U.S. Health News. So for those baby boomers that like to Google and go online, we definitely encourage them to go in there, and you're going to see that we're a high level performing. Again, they look at data to make sure that everything's based on their quality measures. I wanted to add something there. We're just talking about Googling and all that. I also encourage our listeners, most of us do it too at home. Before you go to a restaurant or somebody new or type of experience, you go online and Google. Let's Google Fort Lauderdale Health and Rehab. So I do encourage all our listeners to Google us. We actually are the highest rated Google review skilled nursing facility in Broward County. That's something that we're very proud. My team does a very good job. Alex, Bill Simpson, who's also our care manager, and Sarah from Admissions does a very great job at making sure that not only are we providing really good outcomes, but that we're also, the customer service has to be there, and that's something that we strive for. And Alex, I think you've gotten a couple of mentions in the Google review, so we're very lucky to have staff members like that. So that's another thing I encourage our listeners to do. We were also awarded the Silver Quality Award by the American Healthcare Association, and we're currently applying for the Gold Standard, which only a select few skilled nursing facilities in the nation are actually able to meet the criteria. So that's something that we're very excited about.
How difficult is it? Is it to achieve that?
It's very difficult. Actually, believe it or not, the application process is about 6 months. So we're actually doing the application process as we speak. And out of I think there's over 500 skilled nursing facilities in the nation. Literally, I think only 45 can apply for it, and only a fraction of that gets the actual gold award. So that's something that we're lucky to have been able to meet the criteria. And if everything goes as planned, we hope to get that accreditation in December of this year. So we're very excited about that.
Good luck. Fingers crossed.
Yep, absolutely. Fingers crossed and legs crossed. We're also, and this is an important one. This is something that means a lot to us and to our listeners, and for our type of demography population that we try to get. And it's our Joint Commission accredited. For those in the medical field, when you talk about Joint Commission, you're talking about hospital grade accreditation. This is not just minimal compliance from the regulations that come in and regulate the industry, but you're talking about above and beyond. It basically means that you have systems and structures in place that go above and beyond the minimum standard. So we're Joint Commission accredited, and there's two different accreditations that we have. The first one is the Nursing Excellence Program, which basically just says that you have a very strong systems and processes in place. But the one that we're very proud of, and it's really our forte, it's really our niche, is the post-acute program. We're the only skilled nursing facility in Broward County that has this. Our listeners could go to jointcommission.org and they could verify this. And that basically means that a lot of other competitors out there would say that this is really their niche, but how many of them actually have an accreditation to support that? We can say that we have that accreditation, and it just basically means that not only do we have a really good nursing and rehab department, and outcomes are really great, but once they're discharged from our facility back home or to their assisted living facility or independent living facility, that they're able to stay healthy and not go back to the hospital. So that's something that we're very proud of. And one of the last things I do want to mention is that for the last 3 quarters in a row, we have been awarded the best transitions of care for skilled nursing facilities from Holy Cross Hospital. So that's a really big thing for us.
Okay, perfect. On that note, we're going to take a short break, and we'll be right back right after this commercial.
Excellent.
Thank you.
If a tree falls in the woods and no one is around to hear it, does it make a sound? Have you ever felt that your voice goes unheard? And you think that you can make a difference if only someone would just listen? It's time for women in business to have a place to step into your power, a platform to embrace your hopes, dreams, and your visions, a voice to heal and restore. Your voice can make a difference. We have the platform to share your story and let your voice be heard. Be kind to yourself. Give yourself the chance to be heard and shine bright. Contact New Dawn Media by texting CAFE to 80800. That's CAFE to 80800.
Welcome back, and you're listening to your Hometown Health Show. I'm Yolanda Santana, and tonight we have Alexis Morfa, Administrator, and Alex Connor, Community Liaison with Fort Lauderdale Health and Rehab. Welcome again, and thanks for being here. So we were just talking about your accreditations and the significance. And congratulations on your Google rating and
Thank you very
your
much.
Silver Quality Award
Yep.
and so many accreditations and awards that you guys have. You touched on how the ratings are achieved a little bit. Did you want to divulge a little bit further?
Sure. So, again, just wanted to just add that, quality outcomes. What is that, Alex? You keep saying that word. I mean, what's quality outcomes all about? So, what that basically is that I'll give you a perfect example. This happens to us on a daily basis. Mom or dad end up going to the hospital. They can't walk. They have a pressure ulcer, and they end up coming to a facility like us. So what my team does is that our goal is to get mom or dad or your loved one back to where they were before. We want them walking. We want them without that pressure ulcer. So what CMS does, or the STAR rating, the way they work is that they look at how the patient was doing when they arrived to our facility, and how did they do once you discharge that patient. And of course, each case is different. But our goal is to, if mom or dad or that loved family member that was in the hospital was walking before, our goal is going to be to try to accomplish that same thing. And then for the pressure ulcer, which we happen to have a really great wound care program as well in our facility, would be to get that pressure ulcer healed and prevent that pressure ulcer from developing again. So that's how they come up with, there's obviously a lot of calculations and algorithms on how they look at that, but that's really how they come up with those STAR ratings.
Okay, thanks for that. All right, so there's something called Emergency Room Diversion Program. Can you explain that and explain the partnership with Trilogy?
Absolutely. So basically the ER diversion program that we have and we established with our preferred home health agency, Trilogy, is basically the reality of it is that we don't want our patients to go back to the hospital. And the reason why we don't want them to go back to the hospital is because once they go to the hospital, they have a big tendency of getting other infections that they didn't go in the first place. There's a lot of different comorbidities, a lot of different things that go on. Again, a perfect example is when patients end up going, especially the geriatric patients.
Move closer.
I'm sorry.
Move a little closer.
Especially when the patients end up going back to the hospital, they end up developing pneumonia from just basically sitting in the bed all day. Because technically speaking, that's a lot of the times what they end up doing, they're not ambulatory, they're not walking. So what we have done is that we created a special ER diversion program. So what happens is that once the patient transitions from our facility, they come in, we're able to get them back in shape, they're stronger, they're feeling great, they're feeling back to how they were doing before. We partner up with Trilogy, who's our preferred provider, and they follow them at home. So what Trilogy does for us is that they follow the patient for about 60 days afterwards, and during that transition, we have a 30-day window to readmit them directly to our facility before going back to the hospital. And Trilogy does a very good job. Their nurses have a really good working relationship with us, where if they see that this patient is being symptomatic for some type of infection that was treated with us before, they will get on the phone with Alex, Bill, myself, or my team in admissions and say, hey, you know what, this patient's not really doing so well. Can you come in and assess the patient and see if we could avoid the readmission to the hospital and do a direct admission? So that's kind of one of the programs we have with Trilogy, which has worked very great.
Great. That sounds like a really good partnership. So how is rehab paid for?
Okay, so rehab, most of our it's through the Medicare insurance that most anybody that's 65 years or older or that's disabled or has Social Security benefits has. We also accept Medicare Advantage Plan, or HMOs, as they like to call them, but also commercial, plans cover stiff benefits. We also have some private pay patients that come in. They know about our facility and they pay for that. But most of our population is the Medicare or the Medicare Advantage Plan, HMOs.
Okay, great. What's the average stay for one of the patients?
Sure. So on average, it ranges between how quick somebody could recover or not, and depending on the diagnosis. But on average, we're talking about between 14 to 21 days as an inpatient stay in our facility.
I'm going to go off script a little bit
Sure.
here. So, if someone wanted to go direct to get rehab, do they need to go through a doctor to get
That's
a referral, or can they just come straight
That's
to
a
the
very
facility?
good question, Yolanda. I'm glad you asked. So, if it's a managed Medicare Advantage plan, we can do a direct admission. If it's a traditional Medicare plan or the traditional red and blue card, as some of our patients like to call it, they would have to have a 3-night midnight stay in a hospital as an inpatient.
Okay.
Yep.
All right. And so, what clinical specialties do you excel at?
Sure.
Well, ortho, cardiac, pulmonary, sepsis. And of course, our rehab specialty, which is cardiac rehab, pulmonary rehab, joint replacement, stroke recovery, neurological rehab, prosthetic and ortho training, orthopedic conditions, surgical recovery, and sepsis.
Okay. How, for all of our listeners and viewers, how can people get in touch with you if they have questions or want to schedule a tour?
Well, we're like a hospital. We do answer our phone 24/7, and they can call me directly, Alexandra Connor, and my number's 954-444-2620, or they can call the facility, 954-771-2300. And just like a hospital, we are available 24/7. And we have a little special, the first 10 listeners, individuals, we are raffling an exercise rehab bag with different strengths equipment. So that's kind of exciting for us.
That is for you guys. If you didn't get that, 954-444-2620. Is there a way for them to reach you online?
There is. You could actually go online to our website, for lauderdale-health-and-rehab.com. There's a comment section, or there's an email there. You're more than welcome to go in and look at our website, look at our reviews again on Google. You can leave us a message there. Again, if you have any questions, you can leave a message there, or call Alex again at 954-444-2620.
Okay, great. Can a patient expect an in-person visit in the hospital prior to discharge?
Absolutely. So Alex does a really great job. Bill Simpson, who also happens to be a clinical nurse liaison out in the field, as long as a family is willing to give us permission to go see the patient, or they say, hey, listen, I want to take a look at Fort Lauderdale Health and Rehab. I heard a lot of great things about them. Alex would personally go in there and meet with the patients, answer any questions for the loved one or even the patient, even before being admitted to our facility.
Okay. You have specialist physicians on staff?
That's absolutely. I think Alex said this best. We're like kind of meeting hospital, and we have a bunch of different doctors' specialties in our facility, including.
Currently, right now, we do have internal medicine. We have psychiatrists and physiatrists, which is a rehab doctors, pulmonologists, cardiologists, nephrologists, pain specialists, infectious disease. I said psychiatrists, psychologists. We have podiatrists. We have wound care doctors. We have even dentists and optometrists.
That's great. Okay, that's so much information. Thank you so much.
Absolutely.
Thank you.
What would you like to tell our listeners or our viewers a takeaway about your company, your staff, and your service?
Yeah. So I mean, obviously, I would love for our listeners to give us an opportunity to tour our facility, especially if your loved one is in a hospital right now. Just give us a call. We might be able to help out. Whether or not you decide to choose us, that's something that's very great about us. We're there for the patients. We're patient advocates before anything else. But really do your research. I mean, you're talking about people's lives here. You're talking about mom or dad or your loved one. So I would encourage you, find out what accreditations they have. Make sure you schedule a tour. Make sure you're comfortable. Do they pick up the phone when you're calling them, including the weekends? I think that's very important, and I know that's something that we do a really great job at Fort Lauderdale Health and Rehab. So, just go online. Again, look at the reviews too. That's also important. You could also go to CMS website. That's cms.gov. There's a website called Nursing Home Compare, or Skilled Nursing Facility Compare, and you just read the straight from the Medicare and Medicaid services the information there, and that's very helpful.
Okay. So, and going back to the previous question, in-person visits, are there hospitals or any hospitals that you won't visit, say outside of Broward County?
We would go
Have car will travel. I've gone down to the VA, Miami, Jackson, Kindred in Palm Beach, and it's two of us. So Bill and I, we are a great team. We work great together, and wherever somebody needs us, that's where we're going to be.
That's fantastic. Okay. All right. And then do you take walk-ins? If someone came in, could they be seen right away?
Absolutely. All the time.
All right. Great.
Yeah.
Fantastic. Well, again, for our listeners and our viewers, this has been Alexis Morfa, Administrator, and Alexandra Connor, Community Liaison with Fort Lauderdale Health and Rehab. You can reach them at 954-444-2620. Call right away for that raffle.
Yep.
And they are in Broward County.
Yeah, Fort Lauderdale. We're right on Commercial Boulevard and Federal Highway, right across Holy Cross Hospital.
Yeah, perfect.
2000 East Commercial Boulevard, Fort Lauderdale, Florida, 33308.
There you go.
And you guys are 24/7.
24/7, always available.
All right, that's
Absolutely.
fantastic. Is there anything else you wanted to tell our viewers about staying away from rehab?
Staying away from rehab.
Preventative care.
Yeah, listen, preventive care goes a very long way. Most of our members, who likes going to the hospital? Nobody does,
Right.
But take really good care of yourself. Make sure you follow up with your primary care physicians. Absolutely, that's very important.
All right, perfect. Thank you so much. Again, you've been listening to your Hometown Health Show. I'm Yolanda Santana with Tech One, and this was Alexis Morfa, Administrator, and Alex Connor, Community Liaison for Fort Lauderdale Health and Rehab. Have a great evening. Thank you.
Thank you for having us, Yolanda.
Trilogy Home Healthcare invites you to call our offices before making a decision about your home health and rehabilitative care. Different from other agencies, Trilogy offers specialized service that other agencies don't, providing exceptional care. That's who we are and what we do. Call us at 866-599-4959 or go to trilogyhomehealthcare.com.